I once had a 72-year-old patient, let's call him Mr. Blake, who looked me in the eye and said, "Dr. Kapoor, I've been doing it the same way for 50 years, but lately something feels off." He wasn't sick, no new medications, but something had quietly shifted, and he couldn't explain why. What he didn't realize was that it wasn't the act of masturbation causing harm. It was how he'd been doing it. And he's not alone. I've met so many men over 60 facing the same silent changes: less sensitivity, less energy, less connection. I'm Dr. Maya Kapoor, and in this video, I'll walk you through 7 common self-pleasure mistakes older men make, often without knowing it. And more importantly, I'll show you how to fix them gently, respectfully, and without shame. Because you deserve to feel good in your body, still, now, always. Let's begin. Why you feel less, the hidden cost of porn. After 60, let's begin with the first and perhaps most quietly damaging habit I see in older men: using pornography as the main source of stimulation. I want you to hear me clearly. This isn't about shame, judgment, or moral opinion. It's about how your brain, your body, and your nervous system respond to the kind of stimulation you feed them, especially after the age of 60. Over the years, I've sat across from so many men who've worked hard their entire lives, who've raised families, built businesses, survived heartaches, who now come to me with a quiet, painful admission. They say, "Dr. Kapoor, I just don't feel much anymore. My body feels numb. I don't know what's happening." And every time I ask the same question gently: "Are you using adult content regularly?" And more often than not, their eyes drop, not from guilt, but from realization. Not because they've done anything wrong, but because no one ever told them it might be affecting them this way. Here's what's happening behind the scenes. After 60, your brain doesn't process stimulation the same way it did when you were 25. Your dopamine system, the one that fuels desire, excitement, and emotional reward, is no longer as quick or adaptable. When you flood that system with fast, high-intensity clips, day after day, the brain begins to dull itself to protect you from overstimulation, and that's where the trouble begins. Suddenly, real life doesn't feel as engaging. A gentle touch doesn't ignite the same spark. Even your own body, once alive with sensation, starts to feel distant. This isn't because something is broken in you. It's because your brain is adjusting to what it's been trained to expect: more, faster, louder. And over time, that wiring becomes a barrier to the very thing you're seeking: intimacy, presence, and pleasure. What breaks my heart is how many older men start blaming themselves. They think they've simply lost it, that this is just the cost of getting older. But I'm here to tell you, it's not age, it's overstimulation. And the good news is, it's not permanent. You can reset your brain. You can relearn how to feel again, how to enjoy again, how to let real connection, not artificial thrill, awaken your body. It doesn't mean you need to give up all visual stimulation. It just means you begin to notice how it's affecting you and choose more intentionally. The truth is, your body still remembers how to respond. It just needs space to breathe. So if you found yourself feeling numb, detached, or wondering why you no longer look forward to pleasure the way you used to, don't ignore it. This may be the first sign your nervous system is asking for a reset. You deserve to feel, to connect, to enjoy, not through the lens of a screen, but through your own living, breathing experience. And that starts with awareness, which brings us to the next mistake, a habit that feels harmless, even routine, but might be quietly putting strain on the very part of your body that needs your gentlest care: let's talk about what happens when you make the bathroom your place of release. The bathroom trap, how sitting is silently hurting your prostate. Now, let's talk about something that might seem harmless, maybe even practical, but could be quietly harming your body in ways you never expected. Masturbating while sitting on the toilet. I know, it sounds trivial. It's private, convenient, out of the way. And for many older men, the bathroom becomes a sort of sanctuary, a place where no one interrupts, where there's a door to close, a lock to turn, and a moment of solitude. But here's the thing. What feels like a quiet, simple routine may actually be placing subtle but significant strain on your most vulnerable systems, especially after 60. As we age, one of the most important things we need to protect is blood flow, particularly to the lower body. Circulation is not just about erections or physical intimacy. It's about your prostate, your bladder, your pelvic floor, your sense of vitality and physical grounding. When you sit on the toilet for extended periods, especially in that slouched, hunched position, you unknowingly compress your pelvic region. Your muscles tighten, your blood vessels constrict. The nerves, already more fragile with age, start receiving less oxygen, less nourishment, and over time, this quiet habit can lead to swelling, groin pressure, dribbling after urination, or that frustrating feeling of not being able to fully empty your bladder. Some men even begin to feel aching or heaviness around the prostate, and they never think to connect it back to this private routine. I remember one gentleman, a former teacher named Malcolm, who came to see me about recurring discomfort. We ran the usual tests, ruled out infections, checked his medications, and then, in a quiet moment, I asked him where he usually pleasured himself. He looked surprised and said, "Always in the bathroom. It's the only place I feel private." And I understood. But when I gently explained how that seated posture was placing extra pressure on his prostate and restricting vital circulation, something clicked. He made one simple change, choosing a different space, giving his body room to recline, to breathe. Within a few weeks, his symptoms began to ease. What I want you to understand is this: your prostate is not fragile, but it is sensitive to your habits. It responds to posture, to movement, to compression. When you give it space, literally, you give your entire pelvic region the chance to heal, to restore, to function the way it was designed to. So, if this sounds familiar, I invite you to reconsider where you allow yourself to connect with your body. Choose a place that allows relaxation, openness, and circulation. Stand if it feels right. Recline. Lie down. Whatever allows your pelvic floor to loosen and your blood to flow freely. Because those quiet choices may be protecting your future comfort more than you know. And if this came as a surprise, you're not alone. Most men have no idea how the environment they're in shapes their experience. But the next mistake, one that's even more common, goes deeper than where you are. It's about how fast you try to get it over with. It's a habit rooted in decades of stress, secrecy, or just getting through the moment. But now, it may be stealing the very joy you're hoping to feel. Let's talk about what happens when you start rushing your pleasure. No time to feel. How rushing is draining your pleasure and energy. Now, let's talk about something almost every man over 60 has done at one point or another. Rushed through the experience. Maybe it started years ago when privacy was rare or time felt short. Maybe you just got used to treating it like something to check off the list before bed. And if you've been carrying that pattern into your later years, I want you to pause with me here, because this is where many men lose the most without ever realizing it. When you treat pleasure like a task, your body listens. When you rush, tense up, and just try to get it done, your nervous system shifts into stress mode. Your heart rate climbs too quickly. Your blood vessels constrict. And instead of releasing feel-good hormones like oxytocin and dopamine in full, your body gets only a shallow version, like catching the echo of a song instead of hearing the real thing. I've had so many men sit in my office and say, "Dr. Kapoor, I climax, but I don't feel anything after. I feel empty, sometimes even tired or irritated." And that's no accident. That's your body trying to tell you it didn't get what it needed, not because something's broken, but because the process wasn't complete. There's a kind of healing, a kind of hormonal rebalancing that happens when self-pleasure is done with presence, breath, and care. When you let yourself linger, when you allow your touch to be slow and intentional, that's when the real chemistry flows, the kind that restores rather than depletes. But when you rush, when you push your body to finish without truly feeling, you train your system to expect tension instead of release. And over time, this habit chips away at your sensitivity, your ability to sustain arousal, and even your connection with a partner. You start to believe it's just old age, when really it's the speed that's robbing you. One of my patients, a widower named Elias, put it best. He said, "I didn't realize I'd turned pleasure into a chore." And when he gave himself permission to slow down, to touch without a finish line, something opened up inside him. He began to feel again, not just physically, but emotionally. His confidence returned, not because he was chasing performance, but because he was finally present in his own body. So, if you've been rushing out of habit, out of shame, or just out of old patterns, I want to gently ask you to stop, to take a breath, to remember that your body is still capable of deep sensation, but it needs time, it needs space, it needs you to be with it, not just push through it. Because after 60, pleasure isn't about speed, it's about presence. There is no finish line anymore. There is only now. And speaking of presence, there's a part of your body that most men overlook entirely, something small, hidden, and absolutely vital to every part of your sexual function. It's not visible in the mirror, but trust me, once you understand it, everything about your experience can change. Let's talk about the part of your body that holds more power than you ever realized, the forgotten core. Why ignoring your pelvic floor is costing you strength. There's a part of your body that almost no one talks about, especially not with older men, and yet it holds the key to so much of your strength, function, and confidence. I'm talking about your pelvic floor. Now, before you tune out, thinking that's something only pregnant women worry about, let me tell you something I wish every man over 60 knew. Your pelvic floor is the foundation beneath your entire lower body. It supports your bladder, your prostate, your sexual organs. It plays a direct role in your erection strength, your ability to climax fully, and even your urinary control. And yet, most men go through life never learning how to take care of it until the signs of weakness start to appear. You might have noticed dribbling after you urinate, or a dull ache near the groin that wasn't there before. Maybe you've started feeling less sensation during climax, or struggling to hold arousal like you used to. One man, a retired coach named Dennis, came to see me because, in his words, everything still works, but it doesn't feel like it used to. He was fit, active, and had no major health issues. But what he didn't realize was that decades of sitting at desks, in cars, at the dinner table, had slowly weakened the very muscles that once held everything up. And those muscles weren't firing anymore. They'd gone dormant, like a light left switched off in the back of a house. When you masturbate without engaging your pelvic floor, or worse, when you bear down or push to reach climax, you're putting pressure on your prostate while neglecting the muscles that are supposed to support it. Over time, this weakens the system. It's like having a bridge with no support beams underneath. Eventually, things start to sag, to shift, to fail. But here's the beautiful part. It's not too late to turn it around. You can reactivate those muscles gently, safely, and in just a few minutes a day. The next time you're aroused, whether during self-touch or even just while breathing deeply, try this. Imagine you're trying to stop a stream of urine mid-flow. That slight internal tightening, that's your pelvic floor waking up. Hold it gently for a few seconds, then release. Do it again. This isn't about strength training. It's about awareness. It's about reconnecting with a part of your body that has been quietly holding everything together, asking for attention, for care, for recognition. Because when your pelvic floor is engaged, your entire experience changes. Erections become firmer, climax becomes fuller, and perhaps most importantly, your confidence returns, not from how you perform, but from how you feel inside your own body. Dennis came back a few months later and said, "Dr. Kapoor, I didn't think a muscle I couldn't even see could make me feel this alive again." And I smiled because that's exactly it. This is the kind of change that doesn't just affect your body, it lifts your spirit. So if you've never heard about this before, now you know. And if you've been ignoring it, there's no shame in that, only opportunity. The opportunity to support yourself in a way you never have before. And speaking of support, the next mistake isn't about a single habit. It's about balance, about rhythm, about how often you engage with your body, and how both extremes, too much or not at all, can quietly throw everything out of sync. Let's talk about frequency and why getting it right might be one of the most powerful decisions you make for your health and happiness. Too much, too little. How frequency shapes your hormones, mood, and vitality. Let's talk about something that makes a lot of men over 60 uncomfortable. How often you're touching yourself, or how long it's been since you last did. This isn't about rules or judgment. It's about rhythm, about the quiet signals your body is always sending, and what happens when we ignore those signals for too long or override them completely. In my years of practice, I've seen both ends of the spectrum. Some men are afraid they're doing it too often. Others feel ashamed for not doing it at all anymore. And somewhere between shame, silence, and confusion, most men find themselves lost, unsure what's normal, what's healthy, and what their body actually needs. Here's what I've learned. Both extremes can lead to harm. When a man masturbates too frequently, not out of true desire, but out of boredom, habit, or to soothe an emotional void, his system can start to show the wear. The body grows tired, the prostate becomes irritated, sensation starts to dull. It's not about pleasure anymore, it's about repetition. And over time, that repetition can strip away the emotional richness, leaving behind just a mechanical act that no longer nourishes. I've had men tell me, "I don't even know why I'm doing it anymore. I just feel emptier afterward." And that's because the nervous system isn't being engaged with care. It's being drained. On the other hand, I've seen many men give it up completely. Maybe it's from religious guilt. Maybe it's because their health changed. Maybe they've simply convinced themselves they're too old for intimacy now. But what they don't realize is that the male body, even in its 60s, 70s, or beyond, needs circulation. It needs arousal, not necessarily climax, to keep the tissues alive, the blood moving, the hormones in rhythm. When you go too long without any form of stimulation, the consequences creep in silently. Weakened erections, fading desire, emotional flatness, and even depression. I've watched men slowly lose not just physical function, but their connection to joy, because they believed they no longer needed what their body was still quietly asking for. There's no perfect number, but for most men over 60, 1 to 2 times per week, done with care, not urgency, is often the sweet spot. It's not about frequency for the sake of it. It's about presence, about tending to yourself like a gardener tending a plant, not every day, not too little, but just enough to keep it growing, alive and vibrant. One of my patients, Leonard, once said, "I thought stepping away from it made me more in control, but I didn't feel more peaceful. I felt more invisible." And that's what we often forget. Intimacy, even when it's just with yourself, isn't about lust. It's about acknowledgement. It's about telling your body, "I still see you. I still care for you. You still matter." So, whether you've been doing it too often or not at all, this is your invitation to listen again, to feel again, not from a place of guilt or expectation, but from wisdom. Your body speaks quietly in these years, but it still speaks, and it will respond if you treat it with care. Now, even if you found the right rhythm, even if you've slowed down, reconnected, and tuned in, there's still one habit that can quietly undo all that progress. A habit most men don't even think twice about, but it might be damaging the most sensitive nerves in your body and changing its shape in ways that are hard to reverse. Let's talk about the pressure you may not realize you're using. The silent damage, how too much pressure is numbing your body and changing its shape. Now, even if you've slowed down, even if you've become more mindful and tuned into your body, there's one mistake I see so often, one that quietly undoes so much of your progress. It's something most men do instinctively, especially as sensitivity decreases with age. They apply more pressure, they grip harder, they press or rub with more force, hoping to recreate the feeling they once had. And I understand why. When pleasure feels like it's slipping away, you want to hold on to it, literally. But here's the truth your body is trying to tell you. More force doesn't bring sensation back. It pushes it even further away. The nerves in your penis are delicate. As you move through your 60s, 70s, and beyond, those nerve endings don't respond the way they used to. They're more easily irritated, more vulnerable to trauma, and slower to recover. When you use too much pressure, whether it's through a tight grip, a hard surface, or even a habit of bearing down, you can actually cause tiny injuries, micro tears in the tissue, loss of elasticity, over time, even scarring deep beneath the surface. And what does that lead to? Less blood flow, curvature, pain during arousal, a dullness that doesn't go away no matter how much harder you try. I remember one patient, Samuel, 69, who came to me frustrated and confused. "Dr. Kapoor," he said, "it takes more effort than ever, and still, I barely feel anything." He'd convinced himself he just needed to push through, to work harder. But in truth, his body wasn't asking for more. It was begging for less. When I explained what was happening, I saw the weight lift off his face. Not guilt, but relief. He hadn't failed his body. He just hadn't known how to care for it differently. And that's what I want you to know, too. There is a different way. You can choose a gentler approach, softer touch, slower rhythm, more lubrication. You can shift the focus from chasing an outcome to experiencing the moment. Because when you approach your body with tenderness, your nervous system begins to trust you again. It opens up, it softens, and in that softening, pleasure often returns. Not in a jolt, but in a wave, quiet, deep, satisfying. But there's more to this than just physical technique. There's something underneath all of it that we haven't yet touched, a deeper layer that isn't about how you do it, or how often, or what tools you use. It's about how you feel in your heart, in your spirit, in the space between moments. Because even the most careful touch won't restore what's been lost if you're doing it with a heavy heart. And for so many older men, that's the final, most painful mistake. Let's talk about the kind of disconnection that goes deeper than the body. The kind that happens when you no longer feel like you matter, not even to yourself. When touch feels empty, the pain of disconnection from yourself. This last mistake is the most invisible one of all. It's not about pressure, posture, or even frequency. It's about something deeper, something quiet, and often something heartbreakingly familiar to men in their 60s, 70s, and beyond. It's the habit of touching yourself without emotion, without connection, and without intention, just going through the motions. No curiosity, no joy, no presence. And over time, that absence starts to reshape not just your experience, but your sense of self. I've sat with so many men, strong, resilient men, who've admitted to me in a whisper, "Dr. Kapoor, I still do it sometimes, but I don't even know why. It doesn't feel like anything anymore." And I always listen gently, because I know what they're really saying. It's not about sex. It's about disconnection, about feeling like they've drifted away from their own body and didn't know how to find the way back. When you treat pleasure like a habit instead of a moment of presence, your body stops responding the way it used to. The brain no longer releases the same waves of dopamine, oxytocin, or serotonin, the feel-good chemistry that restores balance and lifts your spirit. What should feel sacred, even healing, becomes mechanical, and mechanical quickly turns to meaningless. You finish, but you don't feel. You touch, but you don't connect. And afterward, you're left with silence, not peace, but a kind of emotional flatness. But here's what I want you to hear most of all. It doesn't have to stay that way. Just because something feels numb now doesn't mean it's gone. Your body still remembers. Your heart still wants to feel. Your spirit, though quiet, still longs for warmth. The path back begins with a small shift, intention. When you touch yourself next, do it as an act of care, not habit. Light a candle, breathe. Place your hand on your chest and remind yourself, this body is still mine. It still matters. I still matter. Even solo pleasure can be sacred. You don't need a partner to experience intimacy. You need presence, gratitude, softness. You deserve to feel fully, honestly, and without shame. Now that we've talked through all 7 of these silent mistakes, I want to help you see the bigger picture. Because avoiding damage is only part of the journey. The real transformation begins when you understand how to rebuild, how to reconnect with strength, confidence, and vitality at any age. You've spent a lifetime taking care of others. Now, my dear friend, it's time to take care of you. Because you deserve to feel good again. You deserve to feel joy. You deserve to feel love. And the best part? That journey doesn't begin with a prescription. It begins with a quiet moment of presence and a decision to believe that your best days might still be ahead. I'm Dr. Maya Kapoor, and I'll be right here, cheering you on. If something in this video spoke to you, no matter how small, I'd love to hear from you. Leave a comment and share what you're feeling or thinking. I read every word. If you'd like more honest, gentle guidance like this, I invite you to subscribe. And if there's someone in your life who might need a quiet reminder that it's not too late, please pass this along.